Hi, friends. Today I am inviting everyone along to visit with me and a midwife named Debby who practices in South Africa. South Africa seems to have just closed their borders, the first of an African nation to do so. And we're going to talk to one of the nation's midwives to find out what is happening there on the ground. So welcome to everyone who's just joined. I want to say just a big welcome and a big I love you in these crazy times, like feel my love flowing to you. And, take a moment, feel where you're sitting on the ground, feel your feet or your bum touching the ground, and just breathe from that place. Don't let the crazy news or the fear of the day take you away. Just get really grounded and centered and, let's breathe together. That's what I like to do. Hi and welcome. So like I said, today we're going to be inviting a midwife from South Africa to join us. So I hope you'll stay tuned for that. And in case you don't know, I have a new playlist on my YouTube channel called Global Pandemic Midwifery Wisdom E-Conference. And I'm moving these Facebook, Instagram live talks over to my YouTube channel. So you can watch them there, getting news from all around the world. And then also you can see our hour-and-a-half long panel discussion on unassisted birth during the pandemic, and that's all over on my YouTube channel. And that's you can search my name, or you can search Art of Birthing, or any of those titles I just named. But the playlist is called Global Pandemic Midwifery Wisdom E-Conference. So welcome to everyone. It's 2:30 my time in the afternoon in Western Australia. Sorry, I have to figure out where I am some days. And a big welcome and a big love to everyone who's just here with us. We're going to be talking to a midwife in South Africa. They just closed the borders there, and we're going to find out what birth looks like in that neck of the woods. So let's see if we can just get her to join. Thank you to everyone who is interested and everyone who is here. So glad to see you all. Let's see.
Okay, I'm a certified professional midwife, and I'm living and working in South Africa in a small town called Manus. And I work in about a 2 to 2.5 hour range from my home. So I travel all over everywhere. But basically, our town relies very heavily on tourists. So we're in lockdown. We're in day 2 of lockdown at the moment. And many of our friends and my clients are they are restaurant owners, or they own little shops, like our neighbor across the road. She owns a little shoe shop. So, I don't know what's going to happen, because kind of they have to pay their staff, but they're not getting any income. One of my clients who I delivered in September last year, they have a restaurant, and they've had nobody there for a couple of weeks. So and that's their only income. So they've got to pay rent, they've got to pay electricity, they've got to pay for food. It's hectic because there's no income. So what do you do?
Oh, that's so hard. Well, so tell us, how are you? How's your spirit? How are you doing right now in the middle of all this?
Well, I'm actually okay. I wasn't really I'm not really a fearful person, so I don't walk around. These things don't send me into panic. Is this specifically a midwifery platform? Is it? I was way more fearful about the stitches than I did on a birth on a mom a little while ago, than what I was afraid of perennial damage that I repaired. I was more afraid of that than of the coronavirus. So there are things that I'm that I'm more scared of than corona at the moment.
That's classic. The midwife is always worried about the actual birth and not the environment. I love it.
Oh, I had about 3 or 4 sleepless nights with this woman, and anyway, actually, it's all really fine. And I don't know what the issues were, but just that freaked me out. This hasn't really, although now yesterday we heard a report from one of the senior virologists at one of the main hospitals in the country in our Western Cape area, and that was a little bit concerning about the spread of virus. So there's a very great difference in South Africa between, races, but between poor and middle class, let's say. That we call the poor areas the townships. It's basically only people of color that live there, black people. And in our suburb, it's extremely quiet. I needed some ginger yesterday. My neighbor left a little container for me outside, and when she went in, I went and I collected it. So we're all careful. We speak to one another, she on her side of the road and me on my side of the road, but just so that you can have somebody to see. But in the township areas, people live in shacks. So there might be a mother and a father and 3 kids that live in some, like a really, the bedroom. There are only 2 rooms. There's a living room and a bedroom, and a bathroom. A bathroom and I think the kitchen is part of the living room, usually, or they only live in one room. And they don't have a bathroom attached to their house. They have to walk a kilometer or half a kilometer or whatever to go to the bathroom. So for them, it's really difficult. Most of the day, these people live outside. They have chairs and they have little, not umbrellas, but like awnings of a sort. And everybody's outside. The life of the town is outside. Now to be cooped up in a 1 or 2 bedroom place, I think must be terrible. And they're actually just not doing it. They're walking around, the kids are playing in the park, running around, playing, people are chatting, having barbecues. I think a lot of them don't actually realize the severity of the virus. They don't realize how severe it is and how contagious it is. Many of them have got multiple other illnesses like HIV and tuberculosis together. So any one of these people, their immune systems are extremely compromised. So I think our government is actually trying to have this lockdown more to protect people like that, and the elderly, of course. But I mean, if this corona gets into some of these townships, we might not have a township left. So and I don't think that we said a 3-week lockdown. I mean, we haven't hit the crest of our infections yet. It's that we're still going up. It's not. We haven't stabilized. We haven't flattened that curve yet. So
I think most places are still going up. The mayor of New York, that's being very hard hit right now, is saying he thinks it's helping, but statistically, it doesn't look that way yet. So China seems to be the only one that's flattened the curve.
Yeah, but I mean, they've had these. I heard they had their first case in June last year. So there are lots of reports flying around. Their forms. Some we get. I mean, on WhatsApp groups. And here's a form. You've got to have this form if you leave. Somebody else says no, that's fake news. Somebody else says no, it's not. I saw it here. Somebody else says no, that's from America or from Australia or something. So you actually don't know what's true and what's not. But the report that I heard, that I listened to yesterday, said that China had their first case in June. So if that's the case, that's a whole lot of months before they've actually managed to flatten their curve.
But
We're
even
nowhere
if
near
we go
that.
off the standard media, which was December 29th or something like that, then it still took 8 weeks of total quarantine to bring the numbers up from rising.
Yeah,
Yeah,
8
so
weeks.
the U.S. is also being in
I
this
mean,
crazy, overly optimistic idea that, you know, very soon people can go back to a normal life, and I don't see how that's true.
no, I don't think so. Okay, as I said, I'm not particularly a fearful person, so, but I think that I have realized that one does need to sober up a little bit, and perhaps I was a little bit blasé initially, saying, oh, it's a virus, and most likely I'm not going to get it, and most likely, you know, should I get it, I'll probably survive. I'm very healthy. I'm taking vitamins every day. I'm fit. I'm young. Youngish.
Me
But
too.
no, you know, I think that, and I'm also not in the shops all day touching everything. I'm practicing washing my hands and all that. So I'm pretty much, I think I'm going to be okay. But that isn't to say that one needs to be too blasé about it, which I was a little bit in the beginning, and my husband has been listening for weeks. All he talks about is corona, 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 and he knows the latest figures, and I just thought, I can't get involved in this. And I mean, we're having a lot of people call and inquire about home births now. About a week before this corona sort of hit Cape Town, we've been having, well, not a week, but the period, the last few weeks, all the obstetricians have withdrawn, the private obstetricians have withdrawn their support from the independent midwives. So basically, if I attend a woman in labor, our backup is going to be the state hospital, which nobody wants to go to. And especially now, nobody wants to go there. But there have been reports coming through on groups saying that doctors are saying to their clients, sorry, you can't have an elective cesarean. Labor at home, come in, have your baby so we can get you out of here as soon as possible. The other thing that's happened is no partners and no doulas, and so no birth support. And I think that is scaring a lot of women into changing their mind and thinking about what they should be doing, and different ways of birthing. One needs to get creative,
Yeah.
you know.
Yeah, the big news in the U.S. is that the American College of Obstetricians and Gynecologists, ACOG, just came out in support of community-based midwives.
Of?
In support
Community-based
midwives.
Community, yeah. For us, it's a little difficult.
They've been fighting us for decades.
Yeah.
I think the problem is so real that we are all re-examining lots of ways that we've taken.
Yeah, but it was just so funny because we've been having this Right to Birth on Facebook. It's a group called Right to Birth South Africa, and we've had meetings and we've had seminars, and we getting women on board with us to say we don't want women. We want women to have choice. It's not really about home birth or not. It's about if you choose, there should be, whatever you choose, there should be good support for you. And one of the midwifery practices of more than 20 years is going to close in July. Well, I don't think anymore because things are definitely changing. But so we sort of having this battle about let's choose and, you know, be able to birth at home, and suddenly there's this little virus that nobody can even see, and it's like the doctors are like, okay, stay at home, it's fine, you know.
I know. I mean, in the U.S., we're hearing stories of doctors telling their patients who are VBACs or who are planning to have twin births to stay home so they can avoid a cesarean. I mean, it's like things we've never heard of. And women are thinking of midwifery attended birth and even unassisted birth, things that previously have been very socially taboo. are now becoming mainstream.
Amazing.
It's shocking,
Yeah.
don't you think?
It is, but it's for me, that's shocking in a good way, because obviously being a CPM, I feel that women should birth at home unless you're sick, unless you've got high risk issues. I have one client that I've had to refer, unfortunately, for GBS, not GBS, gestational diabetes, and that's been quite sad and hard on her, but it's not anything, unless the doctor at a later stage says the sugar is fine and she's happy for her to birth at home, we can maybe consider it. But, you know, I'm getting really requests from all sorts of people saying, you know, can we consider? And the troubling thing is, particularly in this town, people have no money. They have no income because they're not working. And so, what happens now? You know?
Yeah. I know in these for-profit medical systems or places that don't have socialized medicine, there's no way to access payment for the midwives. And so then we're in this crazy quandary, which is like, we really can't give ourselves away for free. And at the same time, there's really no other option for these families. So what do we do? What are you doing? Are you taking clients?
Yeah, certainly I will. We had a family meeting. I have a student that's staying with us now during this time as well, because obviously she wouldn't have been able to travel. And a foster child of mine that was away at university. They both here, so I now have 4 daughters in my house. And we had a family meeting and decided, well, we're not allowing people in or out. Should somebody come to the door, a friend or one of their mothers or whatever, you know, we're actually not going to admit them. I also have my mom and my aunt, 80 and nearly 82, living upstairs in our house. So for their sake as well, not to have people walking in and out. So we made a decision. And then my youngest daughter said to me, but Mom, what if a lady comes to your door and she's in labor? What are you going to do? Is she going to birth in our house? I said, I don't think that will happen. So she said, Mom, but what are you going to do? Exactly a year ago today, I had a client that came to my house, and she was meant to, the baby was about 5 weeks early, and she was meant to go to hospital. She refused. She was they had booked a little self-catering place so that they could stay there and have their baby there, but it wasn't ready because it was 5 weeks away. She had a baby in the bathroom upstairs. So this daughter of mine is a bit sort of concerned that this is going to be happening. Every 4 hours, somebody's going to knock on the door and say, hey, can I have my baby here? And she's like, no, we don't want this. And the older one, she said, Mom, we know you. We know you're never going to be able to leave a birth or turn away from a birth. So then they had a little discussion amongst themselves and thought, okay, it's fine. Whatever happens, we'll just take it as it comes. So interesting, but I'm not.
Here in Australia, most of the nurses and doctors and midwives are now staying at the hospital and not going home so that they don't infect their families.
Yeah. So in South Africa, a certified professional midwife is not actually an acknowledged qualification. It's not an acknowledged certification. So I have to call myself, I'm not even allowed to call myself a midwife. I have to call myself a birth attendant. And in fact, one of our CPMs are being prosecuted because she called herself a midwife, a traditional midwife. So it's very difficult because people don't know what that is. So you have to tell them, well, it's a midwife, but in South Africa, we called birth attendants. And that hasn't caught on yet. So people are referring to me as a midwife. And in fact, I am a midwife. That's what I am. The job that I'm doing is midwifery. And anyway, we have to try and find some way to get around that. There has to be a way.
Maybe this pandemic time gives you
and so, yeah, I think I'm trusting that. So I'm not registered. We don't have a midwifery council. We only have a nursing council. So in South Africa, you're a nurse for 3 years or 3.5 years, and then you have a 6-month midwifery training. And so when you become a nurse, you kind of automatically are a midwife too. And so I don't have access really to work in hospitals. Our state hospital in Hermanus is very friendly. I did a lot of practical work and volunteer work there. So they know me and I'm on good working terms with them. So they'll back me up. But like I had to get special permits. I don't, even right now, I actually don't know whether I will be allowed to travel. But the people that I've spoken to that have seen the documentation have said that should be adequate. So we just hope that everything, that I'll be able to do what I need to do. I'm going to play a bit of the part and walk around with a stethoscope around my neck, and if they stop me, they'll see, oh, okay, doctor, and I've got a sign that says essential services in transit, and
Good.
You know, we'll just see.
I love your proactive work. That's awesome. There's been some chat boards in the U.S. going around about creating an actual laminated neck ID with a picture that says your credential and your CPM number and exactly what you're saying. So I love that you're thinking of creative ways to do that too. Yeah, it's necessary because this whole being a midwife was, I can't actually remember a time in my life where I wasn't interested, fascinated with birth and pregnancy, labor, babies, all to do with what I'm doing now. So I can't think that I've got to this point and then they're going to stop me. You know, I have to. Yeah, I've got to do this. It's in my blood. Yeah. Yeah. Well, Debbie, I'm so happy to hear from you and hear report about what's going on there. As you get these increased calls with people interested in birthing with you, are there any people you're going to turn away? Well, we were sort of chatting about this last night. Obviously, high risk people I won't be able to do because my scope of practice is low risk. So I don't want to be, you know, I don't really want to compromise on that. For me, a VBAC is not low risk. It's a lower, I mean, no, let me say that the other way around. It's not high risk. It's a higher risk, but it's not high risk. So I have currently some clients that are VBACs, and I'm happy to continue with them as we would have done previously. And I think I'll have to just take it as it comes. If I get a call from somebody who I know has been in contact with the virus, perhaps I will, I don't think that I would like to jeopardize my health, the health of my family, and the other women that I see. Even if I believe that I won't get the coronavirus, I think one needs to exercise caution in that regard. So I think, I mean, I do check their blood work, so you know whether they're HIV positive or not. And perhaps one needs to check their temperature, like on a Skype call or something. Yeah. You can see the temperature, the thermometer. The problem, of course, is that the incubation day can be as much as 27 days. And so the very high likelihood is that we are all seeing people who are already positive but don't have symptoms. And then another 30% of people who are positive never show symptoms. So it's a very, very high likelihood that we're all seeing people who are already positive right now and that we won't know until after the fact. So are you and your midwife colleague wearing protective gear? Are you switching to telemedicine? Are you still seeing people? What's the plan there? Well, our drugstore that sells medication and so on is called Dischem. They had no masks. I use gloves, obviously, but they have shown I've read some reports that say it's actually not good really to wear the gloves because it attracts the virus to the gloves, just the usual gloves that we wear, that I would use during a birth. So they reckon that's not a good thing because it actually attracts the virus and it sticks to the gloves. Obviously, during a birth, I will definitely wear gloves. And the masks are not really
protective of the people, of me. So if I'm wearing a mask and you talking to me and you positive, I'm not going to be protected by wearing the mask. What you're doing by wearing the mask is stopping if you cough or sneeze and you've got droplets from spreading them all over. Be that as it may, there are no masks available, and the ones that are available are not. They're just normal masks that the dentist would wear so he doesn't smell your bad breath. You know,
not effective. Yeah.
No, it's not.
Are you or midwives in your area concerned about hospitals becoming overfull with COVID patients and not being able to take care of laboring women anymore?
You see, we haven't really hit. I think yesterday we had 1,170 cases reported. It was up by 200 from the day before. We've had 31 recoveries and we've had 1 death.
Okay.
So I think we're still in very baby stages. I don't know whether, certainly, yeah, I can't answer that adequately. I think the midwives amongst ourselves on our little groups that we're chatting, I can see everybody's a little bit touchy, and we realize that, it's probably still coming. Yeah.
Well, before we close today, do you have any advice or tips or techniques or anything you want to share with the midwives around the globe?
I think we're all in it with our hearts, and I'm not sure that many of us will be able to refuse clients if they are desperate and appearing to be well. And I mean, if a woman arrived at my door and she said, I am positive, but look, my baby's about to be born, what can I do? I don't know if I would be able to slam the door in her face and say no. But I think for me, I would try to proceed with caution, relative caution. And if you and your family are well and they have been self-isolating, more than likely you're pretty much okay. Or symptom-free, I think I would have to do the birth.
Yeah, you're not alone. And that is what makes midwives my favorite people on the planet.
Yeah. This is a calling. It's a calling. It's not a job.
We rush in.
Yeah, I can't stop
While others shrink back, we rush in. So I love you. I'm so glad to hear from you.
Love you too. Lovely to see your face. No more words.
Well, my dear, someday soon I'll come to your neck of the woods and we'll do that workshop we've been talking about. But until then, please stay safe. Take good care of yourself.
Thank you. All of you too, and lots of love and blessings for the midwives out there. Keep doing the good work that we're doing, and may you be protected.
Perfect.
Lots of love.